So I've been in practice for 35 years. I graduated from Princeton University with a BA in psychology way back in 1979. I completed my PhD in clinical psychology at the University of Massachusetts, did my internship at NYU Bellevue Medical Center. Afterwards, I completed a postdoctoral fellowship in treatment of borderline personality disorder at New York Hospital Cornell Medical Center, where I studied under Dr. Otto Kernberg, who was the most famous person in the treatment of borderline personality disorder before Marshall Linehan came along. I taught in the Department of Psychiatry at Johns Hopkins University Medical School for 28 years, where I taught psychotherapy and treatment of borderline personality disorder. And in addition to being a therapist and a teacher, I'm also an author. I wrote a book about hypomania and another one, a psychobiography of Bill Clinton. While I was originally trained in the psychoanalytic tradition, I've always maintained a commitment to eclecticism, using whatever works. But 7 years ago, I added mindfulness meditation to my practice, and I have to admit I have been astounded at what an extraordinary effect it's had on the efficacy of my psychotherapy. When I first introduced meditation, it wasn't as mainstream as it is today, but we now have thousands of studies that show that meditation is as effective as medication and as effective as psychotherapy for every disorder we treat. But unlike medication, there's no side effects, and unlike psychotherapy, it's free. But when combined with psychotherapy, it can be an extraordinarily powerful tool. At the most basic level, meditation allows us to relax. It's amazing how many problems seem less overwhelming once we're able to calm down at will. It also allows us to stop and reflect, a wonderful antidote to many of the impulsive mistakes that we would otherwise make that could have really catastrophic consequences. And finally, if you think of the stream of consciousness as being a literal stream, meditation allows us to take what the Buddhists call the great step backward and get onto the calm, stable bank of the stream, outside of our normal stream of consciousness, and be able to observe what's happening from the outside. Standing on the bank allows us to have a new perspective on every aspect of our life. While by no means am I anti-medication, I do believe that our profession is over-medicating many patients, and that less can be more. There's no free lunch with medication. It is a blunt instrument. And so, to the extent that it dampens symptoms when it works, it also dampens aspects of our mental functioning that we don't want dampened, like our creativity and our energy, which is very important, for example, to my bipolar patients. I often say, more meditation means less medication. If you can learn to self-regulate and slow down and reflect using meditation, then you don't need to rely as much on chemicals to do the job. I've helped many of my patients lower their medication or get off medications that have particularly pernicious side effects like the atypical antipsychotics. And I have found that they've been extraordinarily grateful to me for helping them to recover their energy, their creativity, and their drive. In short, to get back to the people they were before. Borderline personality disorder is very treatable, and I've had a very high success rate over the past 35 years. But there is a caveat. It reminds me of the old joke, how many shrinks does it take to screw in a light bulb? Only one, but the light bulb has to want to be changed. If you're ready to make an ironclad commitment to your physical safety and to your treatment with a therapist who is trained to work with borderline personality disorder, then it's very, very likely that you will see substantial improvement. I've integrated many aspects of dialectical behavior therapy into my work. But if you talk to Marshall Linehan, the founder of DBT, as I have, she will tell you that mindfulness meditation is the core skill that underlies all the other skills that she teaches. Her personal story is actually quite interesting. She herself had a severe borderline personality disorder that was refractory to normal treatment. And she more or less cured herself through meditation and built her therapy around that experience. I have a lot of patients who come to me after failed DBT therapy, and the reason is almost always the same. The therapist themselves is not grounded in a meditation practice and doesn't emphasize it during the therapy. You can learn about the skills of DBT, but unless you actually have a meditation practice, you won't have the capacity to employ them in your everyday life. So it's not that DBT is insufficient, it's that you need to do meditation in order to be able to actually utilize the skills that Marsha Linehan is teaching. I treat all forms of bipolar disorder, but I'm nationally known for my work in hypomania because of my book, The Hypomanic Edge. Hypo is Greek for less than, so hypomania has all of the traits of mania, but to a more mild and more functional degree. So hypomanics are people who have extraordinary energy, drive, confidence, charisma, and creativity. And these can be the sources of their success. But hypomania is a double-edged sword, so it can also be the source of their downfall because they can be impulsive, irritable, impatient, arrogant, and make huge errors in judgment. What meditation allows them to do is to stop, reflect, and listen, and be able to channel their creative energy for the good and avoid the catastrophic mistakes that would take away from their accomplishments. My book, The Hypomanic Edge, The Link Between a Little Bit of Craziness and a Lot of Success in America, was named by the New York Times Magazine Year in Ideas issue as one of the most important new ideas in the world in 2005. The basic thesis of the book is that the character and entrepreneurial success of America is based on our being a hypomanic nation because we're a nation of immigrants. Immigrants are unusual people. They only make up 1% of the world population, and they have an unusual degree of energy, risk tolerance, ambition, and of course the get up and go to get up and come here. If you look at the countries that are the highest in new company creation per capita, they are in order: America, Canada, Israel, and Australia, all nations of immigrants. I do a lot of work with entrepreneurs, and my aim is to help them not only psychologically, but financially, to help them harness their creative energy, but to avoid shooting themselves in the foot by making the classic hypomanic entrepreneurial mistakes. Like, for example, leaping ahead impulsively without considering all of the issues, what one of my patients once described as ready, shoot, aim. Or not listening to other members of the organization who are bringing up valid concerns that need to be addressed. Or finally, the classic mistake, misestimating how quickly money is going to come in and how quickly product is going to go out, which can lead to going belly up because of cash flow issues. All of these are ways that you can essentially destroy the really good work that you're doing. And my aim is to help you to avoid those mistakes and to capitalize on your creativity and your good idea. Meditation is a valuable new tool, new to psychology at least, in the treatment of depression. We know that meditation reduces activity in a part of the brain called the default mode network that we know is overactive in depression. That voice in your head that's constantly criticizing you, that is the default mode network. What meditation allows us to do is two things. One, reduce the intensity of that voice, but two, take that great step backward that allows us to step outside of our stream of consciousness and observe that voice, but not give it so much power over our well-being. The combination of psychotherapy with meditation, I believe, is the most effective way to treat depression. If the approach I'm describing makes sense to you, then I hope you'll feel free to give me a call, either to ask any questions you might have or to make an appointment. But I do believe that if we work together, we can make progress.